Good morning. We're about to start. If you can hear me, raise your hand. Okay, that's good enough. All right, this morning we will be looking at chapter 7, which is lifespan development. This is the final chapter in section 1, which is introduction, the introduction module. All right, introduction. Humans develop through their lives. EMTs must be aware of the physical changes a person undergoes at various stages of life. It may affect the approach to patient care. So you will adjust your assessment and management based on the changes that occur in various stages of life. Now, starting with neonates and infants. A neonate is from birth to 1 month, and infants is from 1 month to a year. And during this period, they develop at a pretty rapid rate. Now, the vital signs at this stage, at birth, the pulse rate is within the range of 90 to 180 beats per minute, and it tends to be closer to the higher end than the lower end. And the respiratory rate is 30 to 60 breaths per minute. Shortly after birth, the pulse rate drops to 100 to within the range of 100 to 160. Ideally, we want it in the higher range than the lower range. And the respiratory rate slows to 25 to 50 breaths per minute. By 1 year, the respiratory rate slows to 20 to 30 breaths per minute. And a lot of these numbers, you're gonna need what we call a cheat sheet. So you're gonna need your cheat sheet and your protocols as a guide to remember some of these numbers. Now, the blood pressure for neonates and infants directly corresponds to the patient's weight, and it typically increases with the more weight that the patient puts on. Weight. Neonate weighs 6 to 8 pounds. That's 3 to 3.5 kilograms at birth, and growth of about 1 ounce per day. The weight triples by the end of the first year. Now, their cardiovascular system at birth, neonates make transition from fetal to independent circulation. So prior to birth, they rely on the mother for circulation, but after birth, their circulatory system takes over. And for their pulmonary system, infants younger than 6 months are prone to nasal congestion because they rely more on their nose for breathing than their mouth. So they rely more heavily on their mouth, on their nose than mouth breathing. And because of the size of their airway structures. So the tongue in this population group takes up a large amount of space in the mouth. right? So the tongue is large in proportion to the mouth. Their epiglottis is larger. Their ear passage is more narrow, and they are top heavy, right? Top heavy, so their head is a little on the big side. So you can't put them completely flat on a surface when you're managing their airway. Their shoulders have to be elevated slightly to get their head in what we would call sniffing position. You cannot use the head tilt chin lift for this population. You put their head in the sniffing position, because if you go completely with a head tilt chin lift, it can cause the ear passage that is narrow to kink. Now, for their nervous system, evolution continues after birth. The moral reflex, neonate opens arms wide, spreads fingers, and seems to grab at things. They have a palmar grasp, occurs when an object is placed into the palm. And they have a rooting reflex. When you touch the cheek, they turn to that side. And they have a sucking reflex, which occurs when a neonate's lips are stroked. Now, at this stage, their only way of communicating is crying. And different cries will mean different things, and the parents and caregivers get accustomed to that. The fontanelles. The fontanelles are spaces between the bones that eventually fuse to form the skull. The posterior fontanelles fuse within the first 3 months, and the anterior fontanelle will fuse between 9 to 18 months. Infants' immune system maintains some of the mother's immunity, so they will have passive immunity, and they get that from their mother. But usually when they start to enter the toddler stage, they lose that passive immunity, and they will develop immunity through acquired immunity. So when they are exposed to the germs, their body will develop immunity at that point. Now, psychosocial changes begin at birth and evolve as the infant interacts with the environment, and there are numerous characteristics that will develop at various stages. Crying is the main method of communicating distress. Infants develop relationships with their parents or caregivers at different rates. Bonding is based on a secure attachment. Anxious avoidant attachment is found in infants who are repeatedly rejected, and separation anxiety is common in older infants. Trust and mistrust involves an infant's needs being met. All right, now the toddler and the preschoolers. Toddler is from 1 to 3 years. And during this stage, the pulse is going to fall between 90 to 150 beats per minute. The respiratory rate is going to fall within 20 to 30 breaths per minute. Systolic blood pressure is 80 to 100 millimeters of mercury. And the temperature is between 96.8 degrees Fahrenheit to 99.6 degrees Fahrenheit. Now, during this stage, they start to move around. They don't balance very well, so they are prone to falls. And because they are top heavy, if they fall, most times they're going to hit their heads. They are still considered small pediatric patients, so your concern should be around your ear passage if it's an emergency situation. If their airway is compromised, they will quickly go into cardiac arrest, just like infants and neonates. For the preschoolers, that's 3 to 6 years, the pulse rate now starts to fall within the range of 80 to 140. The respiratory rate is 20 to 25 breaths per minute, and the systolic blood pressure is 80 to 100 millimeters of mercury. Now, the preschoolers, during this stage, weight gain should level off. The passive immunity is lost, so they no longer have the immunity that they acquired from their mother. Toddlers now acquire immunity as their bodies are exposed to various viruses and germs. Neuromuscular growth also makes considerable progress at this age. Average age for completion of toilet training is 28 months. Psychosocial changes for toddlers and preschoolers. They learn to speak and express themselves. They master basic language. They interact and play games with other children. They begin to understand cause and effect. And they learn to recognize gender differences by observing role models. Now, the school age, which is 6 to 12 years. At this stage, vital signs start to get closer to the ranges for adults. So the pulse is 70 to 120 beats per minute. The respiratory rate is 15 to 20 breaths per minute. And the systolic blood pressure is 80 to 110 millimeters of mercury. Now, as I said, in the field, we do not try to remember these numbers by memory. We have charts that we use for pediatric population that will guide us in terms of assessment and treatment. So you have your pediatric protocols, you have your Breslow tape. There are a lot of tools that we use to remind us of certain range and treatment for the pediatric population. Now, continue with school age children. Obvious physical traits and body function changes become apparent. Growth of 4 pounds and 2.5 inches each year. Permanent teeth come in. Brain activity increases in both hemispheres. Psychosocial changes, pre-conventional reasoning. And this means children act to avoid punishment and get what they want. Then you have conventional reasoning. This means children look for approval from peers and society. And you have post-conventional reasoning. Children make decisions guided by their conscience. Self-concept and self-esteem also starts to develop. And we have adolescents, teenagers, 12 to 18 years. The vital signs level off. The pulse is now 60 to 100 beats per minute. Respiration is 12 to 20 breaths per minute. And the systolic blood pressure is 90 to 110 millimeters of mercury. They have growth spurts during this period. Over a 2 to 3 year time frame. Girls finish by 16 years, boys by 18 years. The reproductive system develops more during this stage. Secondary sexual development takes place. The voice starts to change. Menstruation begins. Acne starts to develop. Psychosocial changes. Adolescents and their families often deal with conflict because at this stage, they feel that they are capable of making their own decisions and they want to be treated as an adult. Yeah, so that can develop, that can cause conflict between family members. Privacy becomes an issue. Self-consciousness increases. Adolescents may struggle to create their own identity. Depression can occur at this stage, and suicide can also develop at this stage. So antisocial behavior and peer pressure peak at age 14 to 16 years. They start to experiment with smoking, illicit drug use, unprotected sex, eating disorders. Code of ethics develops, high risk of suicide and depression at this level. And at this stage, they need a lot of guidance. Now, early adults, that's 19 to 40 years. Vital signs do not vary greatly at this stage. The pulse is going to be within 60 to 100 beats per minute. The respiratory rate is 12 to 20 breaths per minute, and the systolic blood pressure is 90 to 140. Now, if the person is in good shape, the systolic can be below 140. But if they are not in great shape, as we get older, the systolic blood pressure starts to go up if we're not in good shape based on our age. From age 19 to 25 years, the body should be functioning at its optimal level. And we start to develop lifelong habits at this stage. Psychosocial changes, life centers on work, family, and stress. We start to think about settling down, marriage, family life, one of the more stable periods of life. Middle adults, this is from 41 to 60 years. The vital signs remain the same. So we're looking at a pulse rate of 60 to 100 beats per minute, a respiratory rate of 12 to 20 breaths per minute, and a systolic blood pressure of 90 to 140 millimeters of mercury. Middle adults are vulnerable to vision and hearing loss at this stage. Cancer incidence increases. Menopause occurs in the late 40s or late 50s for the female population. Diabetes, hypertension, and weight problems are common, right? Because the metabolic rate starts to slow down. Exercise and healthy diet can diminish the effects of aging. Now, psychosocial changes focus on achieving life goals, so that is important at this stage. Readjust lifestyles as children leave home. Generally have physical, emotional, and spiritual reserves to handle life's issues. Maybe caring for both children and parents at the same time. Older adults. So this is 61 years and older, and the life expectancy is constantly changing. Now it's approximately 78 years, and people are living longer now if they're not murdered, right? So persons are living much longer now worldwide in developed countries because better technology is available, better healthcare is also available. There is better understanding of certain illnesses and diseases. Vital signs depend on the patient's overall health, medical conditions, and whether or not they're taking any medications. Older adults are often able to overcome numerous medical problems but may need multiple medications. And they usually this population usually have a lot of medication. Now, for their cardiovascular system, it declines with age, largely due to atherosclerosis. And what that is fat building up in the walls. Let me not use a blue, let me use black. So let me draw the artery. So this is the artery. And what atherosclerosis is, let me use a bright color, red. It is fat. Oh, don't want any more lines. I want a pencil. What atherosclerosis is fat. So it's cholesterol or fat building up in the walls of the artery, right? So fat starts to build up in the walls of the artery, and over time it can stiffen, change can become hard, right? So that fat can become hard over time. When it hardens, it becomes arteriosclerosis. Now, if you're seeing the diagram that I have here on the slide, you'll note that as the fat builds up, the diameter of the blood vessel becomes narrow. So over time, this person is gonna develop high blood pressure, and that can put strain on the blood vessel, and it can put strain on the heart itself, right? So that's atherosclerosis. We'll go into it a little more as we get deeper into the course. The heart rate and cardiac output will decrease over time. So the heart muscle doesn't stretch as effectively as it did in the early stages. The blood vessels become more stiff and less pliable. The ability to produce replacement blood cells decline, and as does the blood volume. For the respiratory system, the size of the airway increases, the alveoli surface area decreases, and the natural elasticity of the lungs decreases. So there's poor lung compliance. They start to rely more on the intercostal muscles, and breathing becomes more labor intensive. Aspiration and obstruction become more likely. So they're at risk for airway problems, just like the young pediatric population. By age 75 years, vital capacity may amount to only 50% of a young adult's vital capacity. Loss of respiratory muscle mass, increased stiffness of the thoracic cage, decreased surface area available for the exchange of air, and the residual volume increases. And residual volume is the amount of air that cannot be removed from the lungs. For the endocrine system, insulin production drops off, and insulin is important to glucose entering the cells. Metabolism decreases. People tend to slow down their physical activity but do not decrease their food intake. That will result in weight being packed on the body. The reproductive system changes to some extent. Men are able to produce sperm, but the rigidity of their penis decreases over time. Women have a decrease in the size of their uterus and vagina. Hormone production for both sexes gradually decreases, and sexual desires may diminish, but they do not stop. For the digestive system, taste sensations decrease, saliva secretion decreases, the ability of the intestines to contract and move food diminishes, gallstones become increasingly common, and gallstones is the bile that is responsible for breaking down the fat. That fluid hardens, so it hardens, and it can cause complications passing out. So it's incomplete products of digestion, specifically the bile hardens. Can be as small as a grain of sand, or it can be as large as a golf ball. And it can cause complications, and if the complications are severe, the patient may require surgery. We will talk more about it down the line. The anal sphincter changes and can produce fecal incontinence. For the renal system, filtration function declines, kidney mass decreases by 20%. There is decreased ability to clear waste from the body and decreased ability to conserve fluids when needed. For the nervous system, motor and sensory neural networks become slower. Neurons are lost, but there is no loss of knowledge or skill, and sleep patterns change. The brain will shrink over time, and there is more space inside the skull. So age-related shrinkage creates a void between the brain and the outermost layer of the meninges. The meninges is the membrane that wraps around the brain, and it has 3 layers. Right? It has 3 layers. Dura mater, arachnoid, and subcutaneous layer. But we will go into it. And so it's the dura, arachnoid, and the pia mater. 3 layers. The pia is the soft layer, and the dura is the hard layer. But we'll go into it down the line. As the brain shrinks, there is more space available. And in your elderly population, they are prone to falls. So they will fall and hit the head. So it's easy for a blood vessel to be torn, and bleeding starts to occur within it can occur above the membrane, it can occur below the membrane, or it can occur directly in the brain tissue. The peripheral nerve sensation is diminished. Increased reaction times cause longer delays between stimulation and motion. There's a slowdown in the reflexes and decreased kinesthetic sense. And what that is, so kinesthetic sense is the awareness. So it's the awareness of a body part or motion within a specific environment. And it is created by sense organs, proprioceptors, which are in the muscles and the joints. So their awareness of their body part moving in relation to an environment decreases, so it put them at risk for falls. And because, as I said, the space is created in the skull, if they hit the head, they can tear blood vessels, and bleeding can start to occur above the membrane, between the membrane, or below the membrane. Sensory changes. Most older adults can see and hear well. They may need glasses or hearing aids. Visual distortions are common. Hearing loss is 4 times more common than vision loss. Psychosocial changes. Until about 5 years before death, most people retain high brain function. Statistics indicate that 95% of the elderly live at home. Financial limits may restrict access to healthcare or medications, and I believe that's a big issue in Jamaica. To get good healthcare, it is very difficult in Jamaica and very costly. More than 50% of all single women in the United States who are 60 years of age or older are living at or below the poverty line. And I believe if we looked at the statistics for Jamaica, might be similar or worse. Elderly need to face their own mortality. Isolation and depression can be challenging. Right? And that brings us to the end of lifespan development. It's a pretty straightforward chapter. It's not a chapter that I needed to go very deep into because a lot of the information will be covered again in other chapters in a more in-depth manner. It's just for you to understand the stages of development and pay attention to what you see occurring for your pediatric population and your geriatric population. In Jamaica, in the private ambulance response setting, majority of the patients will be geriatric. We tend to get very comfortable with our adult patients. If you're not working in a pediatric response system, then you need to spend time and learn your pediatric stuff. These calls can be very difficult, right? So the most difficult calls to get as a responder is pediatric calls with airway complications. So that would be lifespan development. All right, let me switch over.